Well, I'd like to thank you for joining us for the Medical Marijuana and Wellness webinar series. Tonight's subject is sleep, an important subject, I think, for all of us, and something that I learned an awful lot about in preparing for this webinar. I learned a lot of information about sleep, and I learned, more importantly, a lot of information about how cannabis can help us not only sleep better, but also help us with our body, help our bodies rejuvenate, and really help us with our health. I'm joined tonight by Jeff Miller. I'll introduce him in just a moment, but a few housekeeping issues. Over here on the right, you'll see a Q&A button. It looks like two little bubbles. If you have any questions, please type it in there. We're here to answer your questions. Please feel free to ask questions. There's no such thing as a dumb question. We really want to answer your questions and really help you understand the options that you have and look at this and really get to the bottom of this particular subject in medical cannabis. There is a chat button, which you'll find over here. The chat button's that over here. And the chat button, although it's being used, we mainly follow the Q&A button. So if you can help with the Q&A button, that would be great. I'd like to start today by introducing my co-host, Jeff Miller. Jeff is with Move. And Jeff, we had a pretty good discussion earlier today and yesterday. And tell us a little bit about yourself. Tell us a little bit about Move.
Thanks, guys. Thank you, Mark. Thanks, Lee, for putting this on. I really appreciate it. A little bit about Move. We are, of course, a original Florida-based company located in Apollo Beach, just south of Tampa. We have a fantastic indoor grow operation here in Apollo Beach. Glad to live in the Tampa Bay area, originally from Georgia. I've been down in Florida for 10 years with my wife and 15-year-old daughter. Had the opportunity to get into cannabis kind of early on in the state of Florida. My background was originally in pharmaceutical sales. I got out of college selling antidepressants and then quickly realized that was not the path that I wanted to take, and have been fortunate enough to get into the cannabis space here in Florida and work with a great company. I feel it's one of the best companies out there, and not only in Florida, but now with the addition of Verano Holdings, one of the best brands and companies in the United States. Also was fortunate enough to work with patients, and throughout my tenure here in Florida in the cannabis space, I was one of the original founders of Plants Not Pills, which is a patient education platform. So it's been an exciting few years. I'm excited again to be with Move, excited about the future of cannabis here in Florida. It's can't come quickly enough to expand the patient base, expand physician, expand the education, which what Marc is doing here with seminars tonight, and the Marijuana Aware program that he operates. So glad to be here. Thanks again, Marc, and thanks everyone for joining.
Jeff, thank you very much. I should mention that the reason we do the Medical Marijuana and Wellness webinar series is that our goal is to help someone get their life back. We've been doing webinars now or seminars and live seminars and our webinars for over 4 years. And that's the thing I heard constantly, feedback from a lot of patients that have attended. And if I can just help one person tonight, help them get their life back, I think we'll be successful. And so please feel free to ask questions. Please feel free to challenge us on issues. And what we'd like to do is provide you some pretty well vetted information about sleep and medical marijuana. I don't like a lot of slideware, but what I'd like to do is put up some slides. I think it'll help us be able to discuss this particular subject and get to the bottom of it. So let me dive in here, share this screen. And the first thing I want to mention is we are live streaming this on Facebook. Everyone who's RSVP'd and attending this webinar will get an email after the webinar. And that email will give you a copy of or a link to a copy of the video that's on YouTube. It'll give you a copy of the presentation. It'll give you the resources, discounts that you'll see us talking about, and you'll get all the information you need about this as a follow-up to this particular webinar. We do that because there's a lot of information that's being given, so you don't have to try to copy a lot of slides and things like that. But we will give you a follow-up. And I also want to mention it's part of our wellness and webinar, medical marijuana and wellness series. Tonight's sleep, we'll be doing seniors next week, arthritis the week after, dosing after that. So you can see there's a number of subjects. And if you miss any of those webinars, you can go to marijuanaaware.com type in the follow-up page, and you'll be able to watch any of the previous webinars, both from this quarter and as well for previous quarters. So let's dive into sleep, Jeff. Let's talk about what is sleep, because I think the important thing is if we understand what it is, it helps us be able to understand more about what we can do to really help people get better sleep. According to the American Sleep Association, 1 out of 3 people in America suffer from insomnia or some other sleep-related problem. So if you're having trouble sleeping, best way of putting it is you're not alone. And it's something that's a very common problem that a lot of people have. What are the main reasons that people have trouble sleeping? According to the ASA, pain and anxiety. Those are the main reasons why people have trouble sleeping. And also, sleep is very dynamic. It has multiple forms, and we'll be talking about that as we go along.
And coming out of the pharmaceutical industry, anxiety, depression, pain, they're tremendous barriers to having quality sleep. So it's super important to control those two, pain and anxiety, to get the sleep that you're looking for, Marc.
Yeah, and as I mentioned, as we went through this, sleep does a lot to help us really maintain our health, and also our health both physically and mentally. But I think it's important that we look at what sleep is, which again, we're going back to the American Sleep Association, and they're talking about it being an altered state of consciousness, where we're able to actually just have our bodies relax to the point where when we die, we have involuntary muscles just relaxed. We have potentially REM sleep, which is rapid eye movement. And it's interesting where we don't necessarily have interactions with our surroundings. It's interesting that one of the things that constantly gets pointed out in almost every article that I read is how it helps people both mentally and physically as we go along. Now, why do we sleep? In other words, why does the body need sleep? Well, it's interesting. First of all, it's basically to survive. What's interesting is that when you look at the effects that sleep has on our body, it helps to lessen the negative effects that we see. It also gives the nervous system a chance to really rejuvenate itself and to bring itself back to reboot itself, much like a computer, to really get ourselves back to where we want to be, our homeostasis state. And also, it's important to understand it helps us grow and heal. I mean, I'm a senior citizen, and I always worry about how much I'm going to grow, but my issue is more in healing. When I have particular problems, you'll notice that when you do have any particular illness, especially one that affects you, you sleep a lot. And the reason is your body is saying to you itself, I need to heal. And this is a state that it gets into to be able to heal and be able to do that. You see that quite a bit. So it's important. It's a very important part of our being. It's important for us to maintain that as we go along. So what's a good night's sleep? You know, I got asked that question a lot prior to doing this webinar. So I found this graphic again. I'm talking about the ASA. Then if you look at it, typically over the age of 25, we need 7 to 9 hours of sleep a day. Prior to that, we need a little bit more sleep. As you can see, as a child and in teenage years, it really was helping us in our growth process. But it's really important to maintain that 7 to 9 hours of sleep. And I know, Jeff, you and I chatted about that. Sometimes it's hard to do that with busy schedules, with families, with jobs, a number of things that are out there. And I think also, and be candid, with this whole pandemic, there's a lot of anxiety. People are having a hard time sleeping right now.
There's a lot of depression and anxiety, and a lot of those symptoms cause pain as well. So we're going through kind of an unprecedented time in history. So it's super important to recognize, what's going on with our body and do what's necessary if possible to help, fight those ill effects of everything that's going on right now in the world. So sleep is extremely important. And I know from, personal experience, I'm sure everyone else can attest. Sometimes when you don't get enough sleep, you wear your body down, and then the next thing you know, you've got a cold or the flu, or in some cases maybe COVID out there right now. But it's super important to get that sleep, and hope we're here to help you achieve that.
Sure. So people talk about what about quality sleep, and there's a direct relation to health. When you have quality sleep, it really helps your immune system. It helps your immune system be able to come up and put itself in a state where you have what they call sleep-inducing chemicals that go into your body and really help your body rejuvenate. And more importantly, sleep is very important when you're trying to fight depression, anxiety, stroke, cancer, a lot of different things. Your body again is looking for sleep to be able to be that healing mechanism that we see that's out there. Now, what is sleep itself, or how do we sleep? Let's put it that way. There's a lot of talk about what they call REM sleep, which is rapid eye movement. Rapid eye movement is a stage where we have lower muscle tone, our eyes rapidly move, and we have dreams, and that's where dreams come from. What's interesting in REM sleep is the ASA says that our body gets into a point where we actually are paralyzed. I wouldn't say it's paralyzed, we're really not moving, but I think it's something where our brain is told that it's time to go to sleep. And when it does that, it just drops in this deep sleep and your body's starting to recharge itself. And that's the ideal state that we want to get into, is to get into that REM sleep. Sleeping, non-REM sleep is good for a number of different things, but the REM sleep is really what recharges our body and really gets us going.
Yeah, very important to get into that deep sleep. And that's right. It's like you said, Marc, when your body really begins to heal itself, your cells start to regenerate and rebuild themselves. And you fight off the ill effects of sleep deprivation, really, which can bring on the anxiety, depression, the pain we've talked about.
Right.
Super important.
We'll talk about some techniques. We'll talk about some things that can help with anxiety, because again, in these times, I can't believe there's not anybody that's not anxious one way, shape, and form. And so I think to be able to manage that and handle it is important for ourselves, and also to be able not only get sleep, but also to be able to candidly cope with our lives these days.
100%.
There are some sleep disorders from REM sleep disorders. One of them is people can actually, when they're in this sleep, they can actually move. They can actually act like they're trying to catch a baseball. I know it's one of those things where you've heard about people that try to wake people up and the people hit them. It's not that they're trying to hit them. It's just, this is a reaction that they find because you're in such a deep sleep. That's what they call a disorder that comes out of REM sleep. Is you're really not necessarily something you're doing consciously, but a lot of things that you're doing subconsciously. Now, non-REM sleep, what is that? That's really the first phase of sleep that we fall into. A lot of the scientists look at it as what they call low wave sleep. It is a deep sleep. Your body temperature lowers, your heart rate slows down, and your brain uses less energy. And that's one of the reasons why when you're starting to go to sleep, you're becoming more relaxed, helps you get into that non-REM sleep, helps you be able to start the sleep cycle that you see that's out there. And if you look at how that falls into the different sleep cycles, we basically go through about 5 different sleep cycles. One is we get drowsy, and that happens by that, as I mentioned earlier, you have chemicals in your body that cause your body to tell you that it's time to just relax and recharge. You drop into a stage 1 sleep, which stage 2 sleep, which is a light sleep. That'll typically last up to about 30 minutes, where you're just kind of dozing off. And then you get into a moderate sleep. And again, you're getting into a deeper and deeper sleep, to where you get into what they call deep sleep. And this is where the REM sleep comes into play, where that lasts about 30 minutes, which is interesting, stage 4, that drops into the REM sleep. And REM sleep can last anywhere from 30 minutes to a couple of hours, depending on what's there. And what's even more fascinating is that as we start to wake up, we go back through that cycle the other way. We drop into moderate sleep, light sleep, and then we get into drowsiness. So it's a cycle that's kind of it's at an ebb and flow that we have that goes into our body. And this is important from a cannabis standpoint, because what we're trying to do is we're trying to relax ourselves to a point where we can just not only fall asleep, but also fall into a deep sleep. And then when we get back, we want to feel ourselves rejuvenated and really get ourselves back into our bodies, into what they call homeostasis.
Super important to relax those thoughts, relax the body, relax the mind, to achieve that level of sleep that we're all looking for. And cannabis can be the answer for that. Sure.
Now, what's interesting is, again, these are the stages. I'm not going to really beat them to death. We just talked about it. But I think that you'll be able to, a lot of people can recognize that they're different cycles. What's interesting, when people have trouble sleeping, they're really not dropping into stage 4 or stage 5. They're maybe getting a moderate sleep, they're getting a light sleep, but they're really not getting in that deep sleep. And that's because your body, especially from either pain and for anxiety, it's kind of on edge, and it's kind of keeping you from dropping into deep sleep. I know I had a situation where I had an automobile accident that left me with 7 herniated discs in my neck. And it was very difficult to sleep after that. With the level of pain that I had, it wasn't fun. And I know they tried to put me on some pharma drugs, which I really, after about 2 days, decided that wasn't the right way to go, because it did some pretty bad things in my body. I already had a problem with my neck. I didn't need to have more problems with my body. And I turned to cannabis, which did help me not only quite a bit. I was able to keep my pain level down to less than a 1 when it was really coming from a 7. But more importantly, it helped me do other things like sleep to be able to help my body rejuvenate and to really heal. So let's talk about why when we talk about why do we sleep, there's something also in here, it's important, Jeff, called the circadian rhythms. And circadian rhythms are something that we find very interesting. It's people call it your biological clock, and it's controlled by something called SCNs. I can't pronounce it, so I'm going to call it SCNs. And it's something that it's over 2,000 nerve cells in your body, which, by the way, are tied to the endocannabinoid system, which is why cannabis works so well to help you sleep. But that biological clock helps you turn on and turn off. And our senses in our body, for example, our eyes will notice that it's light or it's not light. And that helps you either bring on the drowsiness or not bring on the drowsiness. And what I found interesting in researching this, and you look down over here, the normal pattern for people sleeping scientifically is 25 hours. And yet our bodies, because of the fact we get up, we wake up, we have schedules, we have alarm clocks, things like that. We've conditioned our bodies over the years to really go to a 24-hour cycle, which is very fascinating. And so a lot of problems that we have sleeping or adjusting to sleep come from this. What's a circadian rhythm? Well, if you've ever flown across country or flown to Europe, for example, and you had a 3-hour time change or a 5 or a 10-hour time change, you'll notice your body is on one clock and reality is the local area is on another. And it takes a few days for your body to adjust to that. And again, that's your body looking at your eyes, looking at the light, looking at darkness. And also people that work at night have to completely change their circadian clock. They have to change it from one side to the other.
It's got to be hard to do. I don't envy that.
Yeah, definitely. I know that I traveled quite a bit across, not only across the United States, but also quite a bit to Europe and Latin America. And I know that was one of the big issues, was just being able to get there and adjust to that particular time zone. And it's something you really never get used to, but it's something that you can manage. This is a typical cycle from midnight, getting your deep sleep, seeing your body temperature lower, and then seeing as you go through the day, all the different functions that go on, where you look at, for example, your best for coordination and reaction time is really the 2:30 to 3:30. And then again, your blood pressure going up, the melatonin kicks in, and then you go back to sleep. So this is kind of your circadian clock, and every person has one of those. And I mention that because as we're managing it with cannabis, it's something to pay attention to. And we'll talk more about this as we go along. So what is the research? Let's talk about medical cannabis and sleep specifically. Again, I'm going to quote one of the authorities. I like the Sleep Association, when they've come out and actually made the link between the endocannabinoid system, which we'll be talking about, your body functions, and also how critical it is to regulate your sleep as well as your circadian rhythms. CBD is really something that has done a lot to decrease the anxiety and your pain, and both it helps you be able to bring on a restful sleep and be able to handle anxiety and to handle the pain that's out there. So, we have authority that is, at least here in the United States, is mentioning cannabis as the answer to really helping people sleep, which I find very fascinating.
I was speaking with a physician yesterday, Marc, about CBD and the importance of CBD in treating anxiety, pain, depression, the symptoms that we're talking about today. And CBD, he referenced it as the building block, and laying that base layer, that foundation, is so important. And then adding the THC on top of that in conjunction with the CBD. So a lot of our products have the CBD and the THC in them, and when a one-to-one on a one-to-one ratio, but that CBD is a super important chemical or cannabinoid in treating pain and anxiety.
Sure. Now, your move helped produce some of the medical evidence that we find out there. Jeff, talk about what move has helped contribute to this, as far as some of the research done on cannabis and insomnia.
Yes, so we were looking at some different research in sleep and in cannabis and helping in sleep and achieving that REM sleep that we talked about, and some of the research that we've looked into it goes into the circadian rhythm and how, the sleep-wake cycle, and how it was believed that, the disruptions in that cycle and that circadian rhythm impacts the endocannabinoid system. And the role of the endocannabinoid system, on the circadian rhythms in itself, have been supported by demonstrating a lack of normal sleep causes dysregulation within the endocannabinoid system. And we've also seen that THC is shown to provide sedating properties, excuse me, and also shown to help reduce sleep apnea, which is your brain had there's actually two types of apnea. One is a obstructive, and one is a cerebral sleep apnea. I'm not sure if many people know that, but where your brain actually is telling your body to stop breathing. You just stop breathing. Not obstructive, where you may be a little overweight and have some tissue around your that prohibits you from breathing, but that your brain. So it's actually been shown to reduce sleep apnea events, cerebral sleep apnea. So in CBD in high doses has been shown to have a sedating effect in patients. So together, and you talked about that, using the CBD as kind of your building block or base layer. So together, using the THC and the CBD, have shown to have a real therapeutic impact on sleep. And
what's interesting is you talk about THC helping with sleep, and a lot of people perceive THC gets you high, but really what you're talking about is not only THC, but also the terpene profiles, which we'll get to, that help you be able to sleep, and it helps activate a lot of those terpene profiles.
Absolutely.
I found this one very interesting. It's these PTS patients. Tell us a little bit about that.
So in this particular study, it showed that, post-traumatic stress was of particular interest to researchers due to the nightmares that it produced, and that often came with post-traumatic stress. And so this is a, generally small study. 47 patients were given a synthetic cannabinoid. Of those 47 patients, 72 either experienced a reduction in nightmares or a reduction in the intensity of their nightmares, which is super important. And it was also noted that the participants had improvements on their sleep time and their overall quality of sleep. Sure, and reduction in night sweats and flashbacks. So super important.
This research study I found very interesting. Tell us about this.
This was actually a really interesting study that we found in 2013-14 in Colorado, when it became adult use, or Colorado when adult use. They did took some data that they acquired from retail locations for pharmacies, and noticed there was a 200% decrease in sleep aids at those locations or in those areas where a dispensary had opened. So pretty significant there, and very surprising. So also the researchers noted that improvement in primary symptoms of management associated with sleep disturbances such as pain and anxiety. So that does
you have over-the-counter sleep medications that reduced by 200%,
right? Which
is interesting. And most of the reasons people were using it was not only just for sleep improvement, but also to address their pain and anxiety. And this has been that way since 2014. Although they're not doing a lot of studies, the amount of products being sold really hasn't come back that much. And interesting enough, even during the pandemic, it's pretty much stayed that way. I know Colorado has been an example of medical cannabis, recreation and medical cannabis, helping a lot of people with the current situation that we're trying to cope with. We talked about the endocannabinoid system, and I don't know how many people know what that is, but maybe we should explain a little bit about what the endocannabinoid system is. First of all, every mammal has an endocannabinoid system, and what that comprises of is Cv1 receptors and Cv2 receptors that we have in the body. What it is it's something that regulates our body. The endocannabinoid system was actually discovered in the 1940s and was made popular in the 80s and 90s by Raphael Mechoulam when he talked about medical cannabis. We're talking about cannabis in general as well as medical cannabis. What we found out is that this is how your body modulates itself. It modulates its pain, sleep, memory, appetite, inflammation, and your immune system responses. It's how your body fights off things. This is how your body manages itself. And the endocannabinoid system is comprised of a series of receptors that we found throughout the body that really help us with our well-being. If you take a look at, let's go to the slide here. If you take a look at the come on you, there we go. The Cv1 receptors, which are the light blue receptors that you see here, are primarily found in the brain and nervous system, where the Cv2 receptors are primarily found in our peripheral organs and also in our immune system. So we have this throughout our whole body. And it's how our body manages itself, and how it regulates itself. And how that works is your body produces endocannabinoids. In essence, you're a small, or I shouldn't say small, you are a cannabis plant. You're producing endocannabinoids. When your brain sees that there's a problem, your neurons, I should say, sees a problem, it says problem. Your brain then triggers and starts producing endocannabinoids, and then that gets sent to that part of your body through your bloodstream to be able to address that particular problem. Now, when we take cannabis, which is phytoendocannabinoids, what we're doing is we're helping to produce or put into our body more of that healing endocannabinoids that we need. Why would we do that? I'm a senior citizen. As a senior citizen, I don't produce endocannabinoids like I did when I was 20 years old. So being able to have some endocannabinoids coming into my body and really supplementing its healing process helps quite a bit. I've talked to a number of doctors, both in the cannabis industry and also outside the cannabis industry about this, people who knew about ECS, and they've all said that anybody over the age of 55 really needs to really take a look at using endocannabinoids to be able to help your body get back into homeostasis. Now, I'm going to caution everybody for a second, and that is that we hear about something called synthetic cannabinoids, which are THC only. Marinol is one that's out there. They have their purpose. There's reason why they've been developed. It is pharma's attempt to create a product that it mimics a plant. And I'm just going to say something very clear. Pharma can't reproduce an apple. They can't reproduce an orange. They can't reproduce a banana. They can reproduce parts of it. They can take a look at some of the healing properties of that, but they're not going to bring the whole plant process together, which is what cannabis is all about. And Marinol and synthetic cannabinoids are very dangerous. Only use them under strict control of a doctor. In other words, it's something that you really don't want to play with on yourself. I mention it because you'll hear about it. People get tempted to take them. Steer clear of any synthetic cannabinoid. I know that the federal government likes to approve them because they're paid a lot of money to approve the studies, but I just think those things are very dangerous. And I'm going to go on record as saying, stay away. Very dangerous.
From me, I came from big pharma, and I understand how it works. And pharmaceuticals do have their place, but I'd definitely choose something that comes from the ground versus something that comes from a laboratory.
Yes, I mean, stick to the natural part. That's what's there. So what happens is your endocannabinoids and your phytoendocannabinoids work together. And again, that's how you control your appetite, your pain, your pleasure, sensation, all the different things that are out there. So specifically, how does it work? Well, we mentioned we have endocannabinoids and phytoendocannabinoids. And when we take them, what's interesting is they are stored in our fatty acids. So the fatty acids of our body act as, in essence, storage cells, batteries for this particular process. When your neurons see there's a problem in your body, when your nerves see there's a particular product, what it does is it then tells your brain that there's a problem here. And what it does is it then triggers what they call long chain fatty acids. It actually builds those. And those are sent through your bloodstream to that part of your body. For example, to my neck to control inflammation and pain. Or I actually had a left knee replacement. I need to be able to manage the pain and inflammation from that. But this demonstrates a couple of things. First of all, no one has ever died from taking cannabis, both recreationally and also medically. Why is that? Because it's your body producing its own endocannabinoids. It's producing its own medicine to be able to help itself. And your body's not going to produce something that's going to hurt itself. It's a natural process that's there. It also explains something else called the entourage effect. The entourage effect is you take cannabis for one reason, and what happens is it turns out that it also helps for another reason. My mother is currently taking cannabis to treat her cancer. She was diagnosed 4 years ago, and she's been taking cannabis, and she's still with us. In fact, I'm going to go see her in a couple of weeks to celebrate her 93rd birthday. That's awesome. When she did that, what ended up happening when she went to the glaucoma doctor, about 3 weeks after she started. And guess what? The glaucoma doctor says you don't have any glaucoma. And she was kind of surprised. He said, what are you doing? She said, well, I'm taking cannabis for cancer. And he said, that'll do it. So your body knows when it has a problem. Your body knows that there's a particular problem that's out there. It doesn't need a doctor to tell you it has a problem. And what it does is it naturally goes out and heals itself. And this is a very important process to the whole healing process for your whole body. So Jeff, tell me a little bit about, I know that we talked about the endocannabinoid system, but when I got in the industry like 8 years ago, all I heard about was sativa and indica. And why don't you explain that? And then we'll talk about what's been going on the last 8 years with hybrids. So what's sativa and what's indica?
Well, there were two strains originally from, I guess, the beginning of time, that, sativa and indica. They each grew in different parts of the world. A sativa, taller in stature, more narrow leaves, as you can see, a little longer flowering cycles. But what you really most hear of sativa is more of an uplifting, more of a head high, more energizing effect, which is true for most people. Not for everyone, but for most. With an indica plant, obviously shorter in stature, little broader leaves, a shorter flowering cycle, and better suited for colder climates, kind of like you heard that, Afghani Kush, grown in high climate, high elevation regions of the country or the world, and more of a sedating effect. So I've heard it many times. It's kind of, if you kind of get confused of, sativa, indica, which one was the one I was looking for? I can't remember. I forgot what Marc was saying. Indica, kind of in the couch, kind of going to put you in the couch, going to help you rest, going to kind of sedate you and get that rest, where and during the day you maybe want to look more into sativa, more energizing, uplifting effect. But kind of that's really the two main plants. Now you've seen with splicing, creating of hybrids between a sativa and an indica, so it gives you a little bit of both. So and what we'll talk about here in a minute is terpenes, and how really terpenes are being found to contribute really in some cases more than either sativa or indica. So if you're having an indica which is high in a particular terpene, which we'll get to in a second, it could have an even greater effect, or a sativa high in a particular terpene. So pretty interesting what science and is catching up as legalization happens more and more across the country.
Yeah, I think, again, 8 years ago, 9 years ago, when I got involved in this industry, all they talked about was sativa and indica. And what companies have done, like Move, is take a look at providing products that really address lifestyle altering medical conditions. And that's where the high cannabinoids come into play. The hybrids is what they call it. It's not sativa. It's a little bit of sativa, a little bit indica. If it has more sativa in it than indica, they tell you it's sativa leaning, or vice versa. Mm-hmm. But really what they're doing is they're blending products to be able to address different lifestyle medical conditions. And I think that's important, because we've really moved this whole industry from the backstreet recreational world to something that's really something that come forward and helps people on a daily basis. And what they've discovered is the terpenes that are in the endocannabinoids or in cannabis really have a lot to do with how things are better. I should mention, we did a webinar last week on terpenes. So if you're really interested in that particular subject, go to marijuanaaware.com, click on the follow-up button, and you'll be able to see that terpenes webinar. It's very informative. It talks about the different terpenes that are out there and what they do. But we'll talk more about them tonight as terpenes affect sleep specifically. So we'll actually land that particular bird. But your biology and dosing is really important. Is that right, Jeff?
Oh, 100%. It's not one size fits all. Everyone is different. Their chemical makeup is different. So it's really just finding what works for you. And some people I've met, sativa gives them more of a calming effect. And it is, traditionally it's just the opposite. So it's really what works for your body. But I would definitely stick to the indicas or the hybrids with more, if you're looking for sleep, looking for quality sleep, looking for that relaxation kind of at the end of the day, or maybe if you work night shifts, early in the morning. So when you need that, get that rest, and you're still kind of, you're still going kind of charged up from the day. but look for the, what works best for you. And sometimes that takes a little bit of trial and error. Like I said, science is catching up with this. It's coming out of the, from the alleys and the back streets to the laboratories. And so we're learning more every day. Science is doing a great job, and Move is doing a fantastic job in employing science to develop products and to educate our med tenders to help patients when they come in to pick that right product that's going to help you. So
and that's an important point. When people ask me about cannabis and they ask me about how do you know how much to take? There's a lot of questions that come up about what should I take and how much do I take? Really, the biology of your body is really what dictates it. And I draw a very similar parallel to alcohol. I mean, I have friends who, if they have one drink, they're done for the night. I have other friends that drink the whole bottle and they're just getting started. I learned that very quickly when I made some trips to Scotland. Don't drink with the Scots, man. They're an interesting bunch. But some people like the light colored drinks, the vodkas and the gins, and some people like the darker stuff, the bourbons and the scotches, and some other people like some drinks with umbrellas in it. That's what makes cannabis. That's work for you.
That's right.
It's a personal tuning of your body. You personally tuned when you started getting into alcohol, whether you like beer, wine, whatever. You kind of went through a process of learning, and it's a very similar process to go here. Now I'm saying we have a saying: go low and go slow. We don't recommend that you just dive into it. And I know there's one question about RSO oil, and I know that Emily will answer your question as we go along. But really, you have to be careful. You have to ease into this thing and not dive into this thing, so you can figure out your tolerance to THC, and then you can figure out also if you are tolerant, if you have a tolerance issue to CBD. Sometimes people do, and we're going to use terms like 1 to 4 or 4 to 1. When we do that, the first number that we give out is how much CBD is in the product. The second number we give out is how much THC is in the product. And we'll mention that again, but being able to find out where your THC tolerance is, and then being able to up the CBD level will actually help you be able to fine tune what's there. I know that in my particular case, I have a high tolerance to THC. I also have a lot of pain. When you have 7 herniated discs in your neck, you have a lot of pain. So the best ratio I use is either a 1 to 1 or better yet, a 4 to 1. Okay. Is something that's out there. What's interesting from my wife's perspective is she's using something like 12 to 1 and 20 to 1s, which is better for her. It's out there. There are days that if I have a lot of pain for whatever reason, I may go to a 1 to 4, which is 1 CBD to 4 THC. So it really takes a look at what's there, and experimenting and trying it is something that really is important to you. How long does it take you to get to know what your dosing is? It took me about 2 weeks, and I think it's not unrealistic to think you can get this done usually within a month. But again, go low and go slow. That's what you really want to pay attention to, because you really don't want to have a bad experience, but you do want to have an experience where you know how to fine tune your body. And the most important thing when you're trying to dose is listen to your body. Don't listen to third parties. Don't listen to people that are out there. Your body will tell you what's working, and your body will tell you what's not working. So please spend some time paying attention to it, because it'll tell you, if you're taking too much THC, if you're not taking enough, and if you're taking more CBD, then that's very, very important. Jeff, let's talk about what are the best strains for insomnia. There was a study that was done, and I put this in here. There was a study that was done on which strains work best. By the way, there are other strains that work as well, but from the study, there were four different strains. Jeff, tell us about the strains and what's your thoughts on that?
Yeah, all of these are legendary strains of cannabis, and have been out there for a while now. Great indica strains is the Granddaddy Purple, or Granddaddy Perp, as you may hear it called. It's a fantastic indica strain, super aromatic and fruity. You have the Northern Lights, which was also in this study, a great strain as well. We also Move offers that in our dart pen, our dart pen, and so you can get that in a vape at our dispensaries. Also, the OG Kush, we offer OG Kush in our dispensaries as well. It's great hybrid. And I know Marc mentioned earlier about, not just indica strains, but a hybrid. So a cross between an indica and a sativa, which, comes into, going into the OG Kush and the Blue Dream. Both fantastic strains that can help with relaxation and sleep. In this particular study, the report had 461 different strains, and on a 1 to 10 scale, 10 being the highest, the average was a 6.6. So the ending symptom level of 2.1. So the patients actually had a pretty remarkable, a 4.5 reduction, so their insomnia, their sleep improved.
The pain relief, that much pain relief helped them sleep. And that's not uncommon. Right. I will use myself as an example. When I wake up in the morning, if I haven't done my appropriate cannabis regime, I can have a pain level of a 7 or an 8 in my neck. And this isn't going away. These are herniated discs in the neck. Once I have a regime in the morning that I take, and literally within 3 minutes, I can drop that pain level from a 7 or an 8 down to a 1. So we'll talk about how to do that when we talk about dosing later. But it's really important to pay attention to that, because I've seen it happen. I've seen other people have it happen to them. And this doesn't surprise me, this level of pain reduction that's out there. By the way, I'm doing it without risking my life, without getting addicted.
That is important.
There's a lot of positive effects that are going on here. I'm not addicted to cannabis. I'll be candid with you. What happens though is, in fact, every about 6 or 8 weeks, I take what they call a holiday. I take a day or two off. And what I'm trying to do is let my body rejuvenate itself. I don't want it to get lazy thinking it's going to get all of its assistance from the outside. It helps me just reset. But I have to tell you, after about a day or day and a half, my neck taps my shoulder and says, buddy, you better start doing something or the pain's coming back. So I'm not addicted to cannabis at all. What I'm addicted to is getting rid of pain. And I think there's a big difference to it. I have no withdrawals. I don't have a handshake. And in fact, with cannabis, I'm able to conduct some webinars like this. I'm able to deal with the public. I'm able to be a somewhat normal human being. I can't call myself normal, but I'm able to basically interact, because without the pain and the inflammation, I'm able to get my life back. Let's put it that way.
The anti-inflammatory properties that you touched on, Marc, are so important, and we're finding out more and more every day of just how the inflammation process affects so many different parts of our body and our organs. And so, touching on that that inflammatory, property, anti-inflammatory properties of cannabis is it's super important. And I think as we catch up, science catches up, we're going to see more and more of that being uncovered, and how that just affects so many different aspects of our our
now we talked about terpenes earlier. What are terpenes? Terpenes are the outside of the plant grows terpenes. Terpenes you'll find in essential oils. You've probably heard of lavender. In cannabis, we have linalool. Cannabis does produce this, and what it does is it helps protect the plant. It makes it so that other animals don't eat it. It makes it uncomfortable for people for it to be other plants to attack it. It's a defense mechanism by that plant for itself. But it's interesting how it doesn't hurt us. It actually acts the opposite. It helps us in a lot of ways. And these are some of the top terpenes that we find that help with sleep. You want to take a few of these, Jeff, and tell us about them?
Yeah, I'll take the first one, pinene. It's the most natural reoccurring terpene in the world, right? So if we've taken a walk through the woods, we've smelled pinene, right? It's the aroma from pine needles. So kind of talking a little bit more about terpene. If cannabis were a wine, the terpenes would be the notes of that wine. So it's the subtle sense, the subtle taste of the cannabis plant. Like Marc mentioned, the essential oils that are in these plants. And so realizing more and more every day that these terpenes are contributing so heavily to the overall effect that people and individuals are feeling from the cannabis that they're consuming, either inhaling or ingesting. And so pinene, for example, I mentioned the pine needles. It has an analgesic, pain relieving effect, anti-anxiety effect, which can also, help people sleep. And you're anxious at night or anxious in the morning after you get off work. If you're working, night shift, this can definitely help. So it's a super important terpene in cannabis. Another.
And one thing about pining we should mention is
Mhm.
it is a very important, and it's one of the main, by the way, there are over 200 different terpenes in cannabis. These are kind of like the top 6. So
That's
we
right.
don't realize that cannabis is limited to just this. We could talk about terpenes. That's why I had a webinar on that a week ago. We could talk about that a long time. We kind of took the top ones that address sleep, but pining also helps recover your memory. That's good news. It's also, if you're suffering from PTS, it could be bad news. So you really, if you're suffering from PTS, pay attention to how much pining is in the product and the effect it has on you. It may not be necessarily something you want to take a look at. And as Jeff had mentioned, you talk about the med tenders, the folks that are behind the counter at Move, they'll be able to advise you as to what the products are, what the terpenes levels are in each of the different products that are out there.
Absolutely, be glad to. We pride ourselves in educating the patients and spending as much time as necessary with each patient at Move. So, if you have a question, we'll be glad to answer that. And we also have live med tenders you can call on the phone or you can chat online with to answer your questions. If you before you buy, after
that's a good point, which we're going to bring up at the end. But that's a really good point. We should probably highlight right now.
Sure.
One of the things that Move has is a consulting service, and it's free. So you
That's right.
can go to their website, you can sign up for the consultation. You'll actually talk to someone about your particular case because you have a medical marijuana card. They know the recommendation from your doctor, and they can help you identify the products and the regime that will actually help you with your product. And again, that's free. You have it both you can do it in person or you can do it through telemedicine. You don't necessarily have to go down to your dispensary. Is that correct?
That is correct, sir. Yep.
Yes. And I think that if you're looking, I know we have some questions about what should I be using and how do I start? And really, I think one of the first steps is not only talking to your medical marijuana doctor, but also if you have a dispensary that you like, or candidly, give Move a try. Talk to their consultants, find out what they can say to help you with get your dosing right.
Yeah, and I think if you're new to cannabis and you try Move first, that's great. I think you'll be very pleased. I think if if you've been using cannabis for a while and you've tried other dispensaries, I think you'll be equally or more impressed if you try Move and kind of compare. Well, say you'd think it would be apples to apples, but it's actually not. So our med tenders do a fantastic job and working with the patient, spending the time. It's not a kind of a cattle call, get you in and get you out. That's not how we operate. We want to spend the amount of time needed for the patients because we know these are sick individuals. Patients need help. They need answers. They have questions, and we're here to help, and we pride ourselves on that. So
yeah, you have lifestyle altering conditions, and so they're there to help you quite a bit. And that's what it's all about. And again, 1 out of 3 people in the United States are suffering from some sort of insomnia. So don't think you're normal to be able to do that. So tell us about terpene. That's interesting. It's one that's not talked about a lot, but it's interesting in what it does.
yeah, it's the aroma is like a floral, kind of similar to pinene, has that piney aroma, comes from sources like nutmeg, pine tea trees, cumin, has a lot of antioxidant characteristics, as well as that sedative, sedating effects, and also some anti-inflammatory properties. So this is a super important terpene when it comes to sleep, and having that particular terpene in higher levels in your cannabis can definitely help in most cases in achieving the sleep that you're looking for if insomnia is an issue with you.
And linalool, sometimes a lot of people compare that to the lavender for the essential oils. That's also
right.
very important.
Super sweet, floral, fragrant scent, just like lavender, has a calming effect. Reduces anxiety. So another important terpene to have in your cannabis product. So you can see it also has an analgesic effect too. So if you're suffering from pain, and pain is what's keeping you up at night, linalool is a great terpene profile to have within your cannabis product. So
Sure.
super important.
And by the way, things like linalool, myrcene, caryophyllene are in quite a few cannabis products. Myrcene is an interesting one.
Absolutely. Another very fruity aroma terpene. You'll find myrcene in large quantities in mangoes, actually. And it's a kind of anecdotal, but I've heard it for years. Eating a slice of mango before you use cannabis can kind of extend the high that you feel from cannabis. So pretty interesting. Again, has that antibiotic, the anti-inflammatory properties, super sedative, and a great product, or great terpene to have in your products as well. So
and myrcene is found in a lot of cannabis products, but also caryophyllene is found in a lot of topicals, right?
Yes, caryophyllene, another terpene found primarily in pepper, super spicy. Has that analgesic pain relief that we're looking for as well, and super popular in a lot of the topicals, as you had mentioned, with that that analgesic effect from caryophyllene. But yeah, that's that spicy pepper aroma when you smell black pepper. That's it. That's caryophyllene.
And also humulene is kind of interesting because, again, it's that herb. Again, all these terpenes have aromas. So when you smell cannabis, like you smell the flower, this is the smell that's coming out, just like an essential oil. I know that I talked to Chris Cano, who's from Rhode Island. He and I were joking about, or actually laughing about, we can tell the quality of products that we like by smelling them ahead of time. It's kind of like winemakers, sniffing the glass.
That's right.
What's out there.
Yeah, like I mentioned earlier, the terpenes, if you compare cannabis to a wine, terpenes are the notes within that wine. So humulene, super earthy, that the kind of the basil, the sage, that's kind of the humulene that you smell within those plants and herbs, or what you're smelling in the cannabis. So again, a really important terpene to have in your cannabis products.
Yeah, and I do want to mention we talked about these 6. There are other terpenes that are out there, and again, talk to your med tender; they'll be able to help you with that. One of the things that I found in researching this was probably the best article that I read was from Tommy Chong. Now, I know a lot of people are going to say Tommy Chong. Well, look, guys like Tommy Chong, people like Willie Nelson, they've got a lot of experience.
They've been using it for a while.
They've got the scar tissue to tell you what works and what doesn't work.
Absolutely.
And he had kind of the best approach to the whole thing, where he was over here, and I want to mention, it doesn't work as a traditional medicine where you want to take it and it works. What it's doing is it's targeting. If you look at what he says here, it's targeting those things that affect your stress. It gives you a feeling, all the things that give you a feeling of restlessness and stress, it targets those. And what happens is when your body all of a sudden and your mind get to ease, it's easier to sleep. And that's what it's really doing. It's attacking the things that are preventing you to sleep and just letting your body naturally do what it needs to do. And that's what's important about taking a look at this. I thought that was a great definition of what's out there. And also, if you take a look at what's in cannabis, it also has a lot of melatonin that comes into play, and you can have what's a gamba. And that people don't realize that that's something that really the nervous system uses to be able to help you get into a restless sleep.
Yeah.
A relaxed sleep state.
Yeah, melatonin super important in achieving sleep. My wife actually is in medicine. She takes melatonin every night. Unfortunately, she with her job, she can't use cannabis. It's kind of sad. She would love to, but unable to, in fear of losing her job at the hospital. But she does take melatonin. It works, and also Valerian. So
Again,
Very,
I'm going to lean on Tommy's scar tissue and say thank you very much for. It was a great
yeah,
article, by the
yeah.
way.
Thanks, Tommy.
Yeah, there's a lot of talk about what they call CBN, and everybody says it's this cannabinoid that's in cannabis that helps you sleep. And I know that there's a lot of movements right now with what I call the designers part of cannabis, where we talk about the delta 8s, the CBNs, the delta 10, there's delta O's, the different things that are out there. But really, CBN is something that's found in almost every cannabis, every product that we use. And what research has come up and found is that it works at best, ideally, not as an isolate, but in conjunction with CBD and THC. And also it works best when it's combined with things like, guess what? Linalool, myrcene, and humulene. So by itself, yes, it has something, but it's what they call, it's kind of like the baseball. The baseball is only as good as the pitcher and the team. And that's what we're talking about. Let's put it in I want to put that in perspective, because a lot of people rush out and try CBN. And I've had patients that try it and they don't get a positive effect. Well, they don't get the effect. I shouldn't say positive. They don't get a negative effect, but they don't get the sleep that they want. But if we move them into a 1-to-1, or basically let's say a 5-to-1 or a 10-to-1 or a 9-to-1 CBD to THC, that works. So what we're finding out is that the CBN is still in those products, but it has to work again in conjunction with THC and CBD.
Right. And I think, going back to science and going back to what's we're learning day in and day out is cannabinol CBN in using in conjunction with THC and CBD does work, but we really haven't we haven't done I guess we've done testing, but we haven't actually advertised and marketed the levels of CBN within our product. And that's something that we're looking at right now to let patients know, okay, well, we've got this much CBD and this much THC. Well, now people are asking about CBN. I saw a question earlier on in the discussion, which we'll get to when we wrap up. But yeah, it's super important. And I think what we're going to see in the future is, more advertising, if you will, more marketing of, okay, you've got the CBD. We know that. We know THC. Well, how much CBN do you have? And so that's something that we're definitely looking at. And I think you're going to see a lot more, information coming out in product, product information packets and brochures on CBN in the future. So a good question about CBN early on.
Right. So let's talk about dosing forms. There is a question of, do dosing forms affect sleep? And the answer is yes. But let's talk about what they are first. Jeff, tell me about the different dosing forms that are out there. There's a bunch of products from Move. What are they and what do they do?
Yeah, we're fortunate enough to have some great products in our lineup. And as you mentioned, they're different, right? So for those of you guys that out there that are new to cannabis and new to using cannabis, or maybe haven't used it at all yet, again, start low and start slow, but you're going to find out that, using an inhalation product, quick onset, quick off. So quick on, quick off, right? So you're going to get those effects pretty much immediately, but they're going to wear off, probably before you get the sleep that you need. So your edible products, your products that you're ingesting, they're going to take a little bit longer because they're passing through in your stomach and through your liver, and they're going to take a while to metabolize and reach your bloodstream. So, but you're going to have a lot longer effect. So what a lot of people that we talk to, a lot of patients that we see in the dispensary, a lot of patients that I see and talk to, in physicians' offices, they'll use a combination. They may use, a vape, or one of our oral sprays, or one of our meter dose inhalers to get that kind of a quick onset of, almost immediate feeling, and then put an edible on top of that. Maybe it's one of our wanna chews, maybe it's one of our delicious chocolates, or it could be a sublingual, a sublingual tincture or a capsule. So I think it's really important to go back to what Marc mentioned earlier. There's no one size fits all. I mean, and so just, talking to your med tenders, finding out what works for you, taking notes, and we'll get to the really cool product that's out there that we utilize at Move called Strain Print. It's, just documenting documenting how you feel, what you're taking. If you use it in, if you use Strain Print, we'll get to that. It's a super easy, super cool app that we can use, Move can use, to track, what your success has been, but you can use it yourself to go back and see, okay, this worked for me. But, we do a great job in our products, and our research of the product.
I know that when I started out my medical cannabis journey, I chose to use sublingual drops. That's the one that you see up here at the top. It's a couple drops that you put underneath your tongue. Why did I do that? Because when they put the drops underneath your tongue, it goes directly into your bloodstream.
That's right.
Typically, in my case, it takes about 20 to 25 minutes to work. They will tell you that the onset time is about 15 to 40 minutes, and it'll last between 4 to 6 hours. But when I wake up in the morning, again, if I now have a regime that keeps my pain level low for 24 hours a day. But when I was trying to figure that out, I'd wake up in the morning with a level of pain of 7 or an 8. I'd take the sublingual drops, and yeah, they'd kick in after about 20 to 25 minutes. But I didn't want to live with that level of pain for that long. So what I did was I reach out and I grab a vape pen that's out there. In fact, if you look at my nightstand, I've got my sublingual drops and I've got my vape pen that's there. Why do I do the vape pen? Because when I take a hit out of the vape pen, literally within a minute or two, the pain goes from a level of 7 or 8 down to a 1. Now, that's what happens in my particular case. And the first time that I did that, the first time that happened, so I'm mixing and matching these different dosing forms. But the first time I took a hit out of a vape pen and the pain level went from literally an 8 to a 1, I looked over to my wife and I said, "This is crazy." I mean, it's like somebody took a rag and wiped my back and the pain went away. And even this morning when I did it, I am still amazed at how fast it helps. Like I said, I'm able to keep my pain level down pretty much, and I use some things. I use some things to help me sleep. In fact, I use edibles to help me sleep at night. And the reason I use the edible is because if you look at the edibles, they'll last 8 to 10 hours. I want to try to get 8 hours of sleep. So if I want to do that, if I take something else, like if I take one of the capsules or I take the vape pens or something, I've got 2 hours, maybe 6. Then I wake up at 3 or 4 in the morning and I've got to take something else, which is what happened when I had my knee surgery. I was waking up in the middle of the night with pain. When I went over to the edibles, I was able to get a good night's sleep. So just before sleep, about an hour before sleep. And in my particular case, I'm a chocoholic. So me and my chocolates get together. And by the way, I love the gummies. I'm definitely a fan of gummies. My mother loves gummies. My mom is a gummy queen.
Mine too. Mine does too. My 80-year-old mother, she loves the blueberry gummies for sleep, but that's her jam. So she was late being in life, being introduced to cannabis. Growing up, I got caught a couple of times, back when it was still illegal, and she just thought that was the worst thing in the world growing up in a strict Southern Baptist family. But I convinced her late in life that she needed to try it. Now she's a firm believer. You know what? She really gets super relief from our topicals. She was going to have plantar fasciitis, not plantar fasciitis, but bone spurs in her feet 8 months ago, scheduled to have surgery, and I introduced her to our topical, to our Evolve gel. And she's like, if I can forego surgery and she was just couldn't get around any longer and just was being forced to have surgery. Introduced her, and 8 months later, she's getting around, she's walking. She goes, if I can keep this level of pain, keep my level of pain this low, I'm good to go. And so it's, we have people swear by it. My mom being one of them, our topicals and our transdermal creams. So fantastic products there too. So
now, one of the questions or comments that we have, I'm going to bring it up now, is from an anonymous attendee. It's a long question. I'm not going to really go through it, but what they did was they found out that your topical Evolve, your 1-to-1, helped with their particular condition. The problem is they can't find it in their dispensary. They can't find it in their local dispensary, and they can't find it within 75 miles. I know I love your topicals. I love your sports gel.
Yep.
It's just not in stock.
And
I have talked to some of your folks, and I'll let you answer the question, but I think the demand is just really, for those particular products, is just so high. it's just hard for you to keep them in stock. But
the demand is extremely high, and yes, I hear it, on a daily basis. And I'm so sorry that we haven't been able to supply it. It's not a lack of having cannabis. I can tell you that there are other products within our transdermal cream that we are having trouble sources. I mean, the supply chain for the global supply chain is just, it's why you can't find anything. I mean, that's why, it was, early on it was couldn't find N95 mask. It was toilet paper. Now that's supplied. You can find toilet paper, but you can't find the chemicals in the products that we need to create our transdermal creams. So they're coming. They're just unfortunately a little slower than we'd all like, but just be patient. I apologize, but yeah, the world is kind of a mess, and the global supply chain is an extreme mess. I was just reading an article last week. There were like a record number of 49 container ships that were, off the coast of California waiting to get in, and the reason why, there were no truck drivers to transport it, but there was no longshoremen to unload it. So it's just a mess. But we're gonna get there, and apologize for the delay. So it is.
I have to tell you, I agree with you. I have questioned my moved friends quite a bit about the transdermal, about the lotion, the topical lotions. However, I am a huge fan of your transdermal patches. I have one on right now. I wear a transdermal patch probably 4 days a week. I know they last 3 days. Sometimes I found that they sometimes last 4, at least in my case. And I think they're great. Tell us a little bit about your transdermal. Tell us about transdermal patches. I know your patch is designed to last 72 hours, and it's microdosing, right?
Yeah, it is. It's about 2.4 milligrams of THC per hour is what you're getting. But the great thing about, our product, we're seeing patients wait up to 90 hours, 92 hours. We advertise it, an 8 to 72 hour effectiveness. But the beautiful thing about this product is it is a microdose product, like I mentioned, but this product, you can remove it. So if you find it, you're not in pain while you're wearing the patch, remove the pain and then get longer use. I mean, it's probably not smart marketing on my part. We to tell patients that, you can take it off and use it longer, but, we're here for you guys. We know that this is, it's not cheap. And for some people, some individuals, some patients, it is a financial burden. So yeah, if you find yourself where I realize I'm not in pain anymore, take the patch off, put it back in the package. And that immediately stops. I mean, you're not getting any medication. So the medication's still there. What's left, put it back on when you start to feel pain again. So great product.
That's one of the go low and go slow basic tips. And that is that the transdermal patch is the only product, if you put it on, literally it'll be working almost immediately. But if you start getting euphoric effects, you start feeling that, something that's not comfortable, take it off. And within 30 minutes, it'll be the effects that'll be out of your body. It's the only one you can reverse. I mean, you can't get rid of a gummy, can't get rid of the vape, you can't get rid of the flower and the sprays, but you can put the transdermal patch on hold, which is a great way of finding out what works for you and what doesn't work for you. Yeah. And when you're starting out, start with a 1-to-1, 1 THC to 1 CBD, and find out how that affects you. And then also, if you want to increase the amount of CBD, you have a CBD patch. So
that's right.
And so that's important. I know CBD patches are great. Like for example, I fight inflammation all the time. And so that helps quite a bit with that.
And back to a point where if you let's call it, what is it? It's an overdose. If you overdose on a THC and you get a little too high, obviously you're not going to pass away. You're not going to die, but it can be uncomfortable if you just forget. Our chocolates are so good. You can eat too many of them. We've got a great milk chocolate and a great European dark chocolate in 10 milligram squares. But yeah, you can. Someone eats 10 milligrams, it may be too much, where they needed 2 milligrams. So if that happens, if you're feeling uncomfortable, you can always take CBD to help counteract that THC effect, to kind of calm you down, bring you back. and it definitely works. So keep
That's
that
an
in mind
excellent
too.
point. You can also, anytime you're using something with CHC, keep some CBD around,
Yep.
some full spectrum or broad spectrum CBD. And if you get something that you don't like, if you take the CBD, it counteracts the THC. That helps you be able to put it back in balance. Anne asked a great question, and that is, can you use a tincture with a patch? And the answer is, yes, I do. I'll have a THC patch, and I'll supplement it with CBD, or I'll have a CBD patch and I'll supplement with THC. But what I mean by that, I have a CBD patch and I'll take some gummies with it that are high in THC to help be able to get to the sweet spot that I particularly want. The answer is yes. In fact, all of these products you can mix and match together. Just be careful of how much cannabis you're taking, how much THC and CBD, especially gummy edibles, because edibles take a while to work. They say sometimes it takes 15 to 40 minutes to work. Some edibles can take up to an hour. And I know that there's very famous stories, my mother being one of them, that we were told her take a little bit, a quarter of that little brownie and just see what happens. Well, my Portuguese Italian mother, who has the patience of a gnat, decided after 2 or 3 minutes it didn't work, so she grabbed another quarter, and by the time 10 minutes was away, she had the whole brownie. An hour later, she's having fun. And my brother, she called me, my brother, I live in Florida, she lives in California, and my brother go over and see her, and he called and said, "Mom's baked." Be very, very careful, because they give them time. Have patience. Give them time to work. Again, this isn't a medicine where you take 2 pills and call me in the morning. This is something where you're tuning into your body. Give your body a chance to work. It will work. Have some patience, and it's there. Again, most of the edible stories are from lack of patience, or basically they love the taste of the chocolate, one of the two.
Yeah, well, when we were designing our chocolate and coming up, we actually hired a chocolatier to formulate our chocolate candies, and we've actually, instead of making an entire candy bar that was perforated, because we know it's sitting there, people get hungry, they're so good, you just want to eat the whole thing. We made it a little bit more difficult. So we individually wrapped each chocolate. So each square is individually wrapped, and it's also perforated in the middle. So if you want to break it in half, you can easily do that. But okay, you've got to open each one. So you can't just sit there and eat the whole candy bar. So it was, we thought that out, and it's really worked well, and keeping people from overdosing on our chocolate. But they're really good. So I encourage you, if you haven't tried them, you definitely should.
Now, one of the things you talked to me about when we were doing our practice session was the inhaler.
All right. Super cool product, just like, an asthma albuterol inhaler. It's a gas propellant, metered dose, 2.4 milligrams of THC, just, super discreet, just a pump and an inhale. And really like that product. I had one on an airplane not long ago, and people looked at me, it's like, oh, they thought I was having an asthma attack, but I was actually just medicating. So very discreet, works great almost immediately, and it provides some longer term relief too. So and again, you're 2.5 milligrams per dose, so it's you're not going to get that super high THC when you don't get that.
I don't want to wrap up the dosing slide by mentioning flour. Flour is important. It acts immediately, and it also within 1 to 5 hours you have its effective rate. But there's a perception that everybody's going to get the flour and then they're going to go out and let's say be smoking a joint on the porch or something like that. In reality, I heard a very interesting statistic from actually not just one, but a couple of different dispensaries, that up to 30% of the flour that's being purchased is being used for cooking. People are making products with it.
Yeah. There are more and more companies move, included that we're, actually looking and talking with some individuals now that are cannabis chefs to work in developing recipes using our products. So it's a great way to use the product and ingest the product, tasty. And in the more developed markets, out west, California, Colorado, you're seeing a lot of the chefs really get into just, providing like, 5-6 course meals using cannabis in just, amazing ways. There's actually one show that comes on Vice channel called Bong Appetit. It's pretty fascinating. If you get Vice channel and to watch all the crazy, amazing things that they're doing with cannabis. But yeah.
We did an edibles webinar a couple of weeks ago, and I was preparing for it. I talked to a lady named Sherry Cannabis, and Sherry, I have trouble pronouncing her last name. She's the Martha Stewart of Cannabis Cooking, and she was very fascinating. In fact, her and I are going to do, we talked about it, we're going to do a cooking webinar next quarter.
Oh,
we're
cool.
going to talk about actually cooking with cannabis, and she's going to.
Yeah, I definitely want to join in for that. That would be cool.
It was very fascinating, and she actually has what they call calculators. So while you're making your edible or you're cooking or whatever that's out there, I'm going to kind of wrap that up by saying that when I first got into cannabis, there's a YouTube channel called Marijuana Nona, I think is her name, and she's an Italian lady. I know she was in her mid 80s, and she started cooking with cannabis because she had friends that needed to take cannabis but had trouble with the pills and didn't want to smoke and that kind of stuff. So she started cooking Italian recipes using cannabis, and she actually had a whole guide and everything. I don't know if she's still alive and doing this, but she had some incredible recipes that are out there. So, and cannabis cooking is one of the things that's coming. I use cannabis on a daily basis, where I'll take a little pea-size shape of flour and I drop it in my coffee in the morning. And what that does is it releases the THCA and the THC and the CBDA. So these are parts. Your cannabis plant doesn't have CBD and THC in it. It has to be heated and it needs some time. But the heat of the 200 degrees of coffee will not trigger THC, will not trigger the CBD, but it triggers the CBDA and THCA, which is good for pain and inflammation. So since I'm trying to fight pain and inflammation by dropping it in there, I get my pain relief, my inflammation relief, and I'm not worried about getting high.
That's
so
cool.
It's actually a very cool way of doing it.
I'm going to try that.
A lot of teas are made that same way.
Definitely going to give that a try tomorrow.
Yeah, that's something that's there. So we talked about dosing, and I think we talked about go low and go slow, and I've kind of beat to death the concept of just like alcohol, you have to be careful. But really what you need to do is you need to figure out what your tolerance is to CBD and THC, and also figure out which terpenes work best for you. That's what's really important. And again, starting with a 1-to-1, starting with 5 milliliters, trying that out, do it for a day or two. If you don't get any effect, move to 10. That doesn't work, move to 15, move to 20. At some point in time, you'll begin to feel the THC, and that's what what your THC tolerance level is. Then what you can be able to do is maybe back down a little bit, but then increase the amount of CBD to be able to see how that really helps. That's how we did it. And again, my wife does her best remedies are 12-to-1 or 20-to-1 CBD to THC. Mine's a little bit different. Mine's almost 1-to-1. In fact, a lot more THC than CBD helps me quite a bit because of the level of pain that I have. But really spend the time to be able to figure out what your sweet spot is. And I can tell you, if you find your sweet spot, you get your life back. I've done it with literally hundreds of patients over the last 8 years, where I've worked with them and find their sweet spot. And there's nothing more refreshing than when I was doing the live seminars I had one lady come up to me and she asked me if I remembered it from the last seminar. And I said, no, I really didn't. And I apologized. And she said, yeah, because I was in a wheelchair. I couldn't walk. Once you helped me get my card, we got the CBD. She said, now, not only am I walking, but I wanted to walk in here, and she was dressed to the nines. And she said, my biggest problem was I waited till I was 78 years old to find out about cannabis. I waited way too long. And I've now got my life back. She plays cards. She plays tennis. A very active lady. So pay attention to finding your sweet spot that's out there. So let's kind of wrap this up at a bottom line. What is the whole bottom line of this? You're not going to get unexpectedly or uncomfortably high. That's not going to happen. You're not going to get addicted. You're not going to overdose. In other words, you may get high, but you're not going to kill you. Let's put it that way. There's no label that says, if you look at all the pharma drugs, somewhere in there, it's going to kill you. There's none of that's in this. You produce your own endocannabinoids. And also it can maybe help you with the entourage effect, where you're taking it for one thing and it helps you with another. So that's kind of the bottom line of cannabis.
That's right.
Jeff, tell me a little bit about Move and Sleep. I mean, you put together a lot of information on that.
Yeah, so we are producing a number of great products to help patients, a number of great strains from our Velvet Glove, which is an indica, high in myrcene, to our Guru, which is another strain that's an indica strain that we're seeing some fantastic results from. So yeah,
it's out there. You know, we're going to answer a couple. By the way, we're going to answer a lot of your questions as we get through this thing. So let's talk about Move and Sleep, and then that'll answer. Actually, it answers a lot of the questions that are out there right now. You kind of have best of breed in a lot of different products.
Yeah, and we've gone through a lot of these, and for the sake of time, we'll kind of speed it up. But yeah, we've got great topicals. We've developed some great technology, some patented technology in our end cap technology, which we'll get into. Our edibles, our Wana gummies. Wana is a brand that we teamed up with. They're one of the largest gummy producers and make some fantastic products. Tinctures. We have our capsules, which is
Let me go over here. I think this might be a better slide for that right here.
Yeah, sure, right. So you can kind of see our products that we're offering. Pretty much the same as most of the dispensaries and MMTCs out there. We do have some other, like we mentioned, the meter dose. I don't believe any other competitors have that. Our transdermal patches are, you can't compare that to anything else. And our chews, fantastic. And to get back into, we talked about maybe splitting up the dosing. So I find out personally, the Wana chews, we make a 1-to-1 strawberry lemonade or CBD to THC. It's 10 milligrams per chew. You can cut that in half. You can actually cut it again and quarter that. And I'll take a quarter in the morning just if I'm anxious. Sometimes I wake up and think about everything that's going on in my day, and I start to get anxious, and I can feel the tension coming. I pop a quarter, 2.5. They're very homogeneous. So, all the THC or all the CBD is not going to sit in one corner. They're very well distributed in those chews. So you can cut it in half. You can quarter it. Take a quarter, take a half. A quarter works for me. I'll take a quarter in the morning. I may take another one, about 11, 12 o'clock, and then one in the afternoon.
Anonymous asked the question in that particular area about how difficult it is to find a CBD with more, an edible with more CBD than THC. Again, he was ordering a 1-to-1, and he found the CBD THC to be too high. Candidly, first thing is, yes, there are edibles that are high in CBD and low THC. So those are on the market. But more importantly, what you probably ought to do short term is just cut it in half.
Yeah.
You don't have to take the whole thing. That'll probably get you the results you want without having to take, and again, it also costs less because you're taking less.
Yeah, our blueberry and mango, the blueberry being the indica, it's 10 milligrams of THC, but it's strong, a little stronger for me. So, it depends again on your tolerance. It definitely, you want to start slow and find out what's best for you. So again, not one size fits all.
Now, one of the things I like about Move is what you've done is you also partnered up a strain print. And we talked about getting your dosing right. And especially when you first begin, or even if you've been using cannabis for a while, what do you take? How do you take? I know that when I was doing journaling, I didn't have the use of strain print. When I had my knee operation, I was just keeping my own journal as to what worked. I was really surprised. I found the effects that cannabis had when I ate, when I didn't eat, when I ate certain foods that were fatty versus not fatty. I was able to actually get my regime worked out by doing a lot of journaling. And what I know, strain print not only helps you do that, but gives you a lot of information from others that have had this particular condition.
Gives it, it's a great app. You can download it on Apple or Android devices. Super easy to use. Very intuitive. Each time your session or you use cannabis, you go to your app. You usually have your phone in your hand anyway. Put in the strain you're using. Put in the route of administration, what product, and with Move, you can actually receive discounts by using strain print. So if you log into strain print and put in Move FL, and I think that's actually in the notes at the end of the slide, you can actually get a 10% discount for every 5 times you register your session or you enter your journal within strain print. So that could be used up to twice a month. So, but it provides just valuable information, not only for you, you can go back and review what worked best for you. You may have forgotten, you may forget when you get to the dispensary, and like you can pull it up. Oh, I did this what worked best for me. But it provides information and feedback through to a number of people all over the world that use strain print. So super
if you're dosing right, it makes a
Yeah.
huge difference, and this is a great tool for that. Let's talk a little bit about here's our strain print. They talked about cannabis and insomnia, and here's some of the results that you can see where people talked about their sleep.
Yeah, so we had 1,200 individuals, 1,200 responses in strain print, people journaling their session using cannabis, and this is what they said. So 84% said it relaxes their mind before sleep. Huge numbers. 82 said it relaxes their body. So, just amazing, showing amazing efficacy that there. We know out of 1,200 responses, 57% said it resulted in a deeper sleep. And then, of course, kind of spoke about what we're talking about earlier in the presentation with the reduction of over-the-counter sleep meds. 78% said that you use fewer sleep aids. So, again, can't say that it's going to help for everyone, but the numbers don't lie.
Yeah.
So.
Also, you guys I visited your facility in Apollo Beach, and you guys have a great facility for growing flower. I was very impressed, by the way.
Yeah, I'm proud to say it's in my hometown, that my town I live in now. I'm actually a couple miles from the grow. It's pretty awesome to drive past the grow operation and smell the wonderful flower that's being grown here in Apollo Beach. So we're proud of that. It's just I've had the opportunity to visit several grow operations across the state, and it's pretty special.
Yeah,
pretty special.
And having a 15 to 30% cannabinoids by weight, that's rather remarkable, by the way. That shows the quality of the product that's out there.
Yeah.
There. And these are some of again, going back to the terpenes and some of the strains that are there, we thought we'd bring up some of the strains and some of the terpenes that are in them. And some, again, using strain print, here is the result that people have seen by using those.
Right. I spoke earlier about Guru and Velvet Glove. You can see, the terpenes, caryophyllene, and the Guru, the limonene, linalool, which we talked about, comes from or similar to what you find in lavender, that super aromatic scent, and the humulene. You're getting that relaxed, comfortable, happy, kind of pain-free. And then going back to strain print, what we're seeing from our patients that are trying Guru, and they're inputting the data into strain print through their phone, 60% efficacy for insomnia, a 72% reduction in headache, and then 76% efficacy for muscle pain. So some pretty incredible numbers there with our Guru. And then Velvet Glove, kind of similar to the Guru. It's also an indica, given that relaxed, that happy, just kind of forget about the pain. It's just gone. And then, you can see some pretty incredible numbers too, 60%, 64% efficacy for insomnia through strain print, what we're finding, 50% reduction in anxiety, or 52% of the patients that inputted their information to strain print saw a reduction, and then a 62% reduction in stress. So pretty amazing. But again, that's not all we offer. I mean, we've got those in flower, we've got them in vape form.
You also have concentrates.
Yeah, we have some fantastic concentrates. Again, not for the beginners. I wouldn't recommend it, but they are out there for those people that need, that need those super potent, 80-90% THC concentrates. We have some pretty amazing stuff. We have some proprietary technology that we've used to develop our extraction process through a cold ethanol extraction, that we're producing some pretty amazing stuff from our from our rosin to our crumble and
I
shatter.
use concentrates in conjunction with CBD. In other words, I'm able to get my dosing by being able to use the concentrates in the CBD to get the dosing level that I really want. So this helps me tune that in. That's one of the reasons why people use these products. Let's talk about vapes. You got a pretty good vape line. I think you got a new product out, right? Your Dart.
Yeah, the Dart pen, great product through C-Cell. There's the company that developed this battery. There's no button. You just simply, each cart or cartridge is magnetic, and so it just slides onto the battery, which you see there, and then you just inhale. It automatically provides the perfect temperature to provide the perfect hit. So those are all color coordinated, from a hybrid to an indica to a sativa. Each tip. So the green is your hybrid, yellow being your sativa, and then and blue tip it would be your indica. So that goes the same with your pure cartridge too. Those are kind of color coded. Right. So you could have. I'm sorry.
Vapes are fast acting. That's what's really important.
Oh, vapes are super fast onset. Great taste coming in, and just a great product. Where there's the new Dart pens, so we're super proud of those. Of course, we have the disposable pens as well as the 510 thread cartridges too, in the pure and the plus strains.
And here's some of the hybrids. Here's some of the effects and also the terpenes that are in them. I know people have always asked, how do I know what's in the product? I'm just giving you some of that information today to help people understand. You make it very easy for people to find out what terpenes are in your products.
Yeah. So the Black Mamba, great strain, the pure blueberry. These are both the vape pens or 510 carts that we're offering in these particular strains. Super efficacious for insomnia, irritability, and stress with the blueberry. And the Black Mamba, again, fantastic numbers that we're finding from strain print, 60% efficacy for irritability, and then 68 for insomnia. So great products, quick onset. This may be a product that you use early on, and before you go to bed, to get that immediate effect, and then use that in conjunction with an edible, maybe a chocolate, maybe one of the Wana gummies. And for that longer, that
getting into you're here. One of the things, again, we'll mention again, is great for sleep. The edibles, you can take them, let's say a half hour, an hour before you go to bed, and you'll pretty much guarantee an 8 hour sleep.
That's right. Yeah. And so a lot of the patients, that's what we're finding, if they forget to take the gummy 30 or 40 minutes, they hit the vape pen, gives them that immediate effect. And then they eat that gummy before they go to bed. So it's all just about, we've got the right products for, pretty much every patient out there that's, looking to use cannabis to control their pain, their anxiety, to help improve their sleep and their insomnia.
Here's an example of the blueberry indica, which we talked about.
Yeah, that is our indica strain. We have the blueberry was our indica. We also have a sativa, which is the mango, and then the 1-to-1, which I love, is the strawberry lemonade. Fantastic product, great taste. Again, high in caryophyllene, myrcene, linalool, and terpenol. So, and then there's another terpene that we didn't speak of, the neurolidol. So,
71% of the people responding to strain print saying that it helps. That's a pretty high rate.
It's pretty amazing.
Even in the pharma industry, people would take that as a good result.
I think they would take that as statistically significant. Yes.
Right. One of the reasons why your product works so well is because you have what's called the encapsulation technology, right?
Yeah, our NCAP technology, we have patents in the US and the EU. We've figured out how to basically turn a non-water soluble cannabinoid into a water soluble cannabinoid. So it actually would pass through the derma, and through the fatty tissue and into the bloodstream, and then passing through the blood-brain barrier. So you'll actually get a high off of our transdermal product, which is pretty amazing.
Yeah, the fact it goes through the derma is really, really important. I'll keep beating you up about the fact you need to get it in stock. So fix that supply chain, will you?
Right.
But
Can't wait for COVID to be over. I'm sure everyone.
Rather remarkably, that's out there. And then you have end caps. Not to forget, people like to take just the capsule itself. You also have those products available.
Yeah, we have some our capsules. Again, we're using that end cap technology where we encapsulate the non-water soluble cannabinoid, so it enters that your bloodstream. Fantastic product. Comes in the 30 capsules, 10 milligrams a piece. We also have an RSO, which is a 25 milligram capsule as well. So a great product for someone that just doesn't want to either eat anything or vape or trade. Again, you can you get that long-term, that long-lasting effect if you're looking to keep the effect.
Quite a few locations here in Florida.
Yeah, 37 now and counting. We're I'm proud we're opening up one in Pinellas Park, Florida, close to me. So that's going to be our next one. We've got Melbourne coming up very soon. So those aren't showing, but we'll have 39 here very, very soon.
Every time I talk to you guys, I hear about a new, almost every week or so, every week or two, I see another dispensary opening up somewhere.
Yeah, if the counties could keep up and issue the COs, we would be opening them up faster. So we're open just as fast as we can. But yeah, we're proud that we have 37, soon to be 39, and hopefully we'll be having a good coverage. If anyone on the call is in a location they have to travel a little further, just give us some time. We'll get there.
And so you can reach you by phone, right? You have email that they can get to you, and then also you have your patient care line, which we talked about earlier.
Yeah, we have some great med tenders that are there, to help you guys anytime you need it. Well, actually not anytime. You can see our hours there, but in our normal operating hours. Super knowledgeable, very friendly. We pride ourselves on that. So yeah, whatever works best for you, whether it be email, live chat, or if you want to talk to somebody by the phone. We're making sure that we're going to get those in. And we've just opened our new call center up in Apollo Beach. So we're adding even more representative to answer your calls. So hopefully won't be any wait time for you guys if you need it.
So we've kind of run through your slides and our slides. Let's jump into some questions. Let's run through some of these. Dean asked a question. He says, as mentioned in the last webinar, I attended CBD concentrates and the effect of CBD. What is the case with the one-to-one blend? I think what Dean is really asking is one-to-one going to be something that's really effective for sleep?
Again, it all depends. For me, the one-to-one gummy, I definitely feel, I feel a high to it. But, some people are like, I didn't really get anything. It all depends. But, I can tell from the individuals I talk to, even my own personal experience, in the case of our one-to-one, every product that we have, I do get, it's kind of a psychoactive effect, and I do get that relaxation that I'm looking for. So, I think for me, it helps me relax. And then, obviously improve my quality of sleep too. So
one of the anonymous attendees asked the question. I said, I got a gummy in California that was one-to-one, CBD, THC, CBD, and CBN. And you can't find anything like that here in Florida. Are you aware of any product like that here in Florida?
I'm not aware of a one-to-one. There may be something out there, and again, what you mentioned earlier is that, our products do have CBN in them. We just really haven't listed that as, like kind of, on the packaging or in our,
listed it as a main ingredient. Yeah.
So, if you don't want, any head high at all, I would suggest, try maybe a quarter, or with a quarter of it, the quarter of the gummy for me, of a one-to-one, you're not getting anything like this just over the top. It's kind of like for me, it's just like I just realized, oh well, I'm calm. I didn't even, I'm not like, oh my God, I'm stoned or I'm high. It's just more of a relaxing than I've realized that I'm not stressed out anymore. So could be something that that could help you.
Yeah,
But
one of the questions that Emily had, I think is a good question, is she said she bought some Rso Tincture. I took too much and had a bad trip. Now I'm scared to try to take it again. What's a good start and what's good for sleep? I think this is an example of go low and go slow, because RSO is something it's very high in THC. You got to be very careful.
yeah, the starting dose of RSO is like a grain of rice size. And I think that's about 25 milligrams. That's way too much for me. I'm going to get super baked on, with that much. So again, maybe you go back and, not try the RSO, or just try much, much smaller, maybe even the size of a pinhead, right? It's just literally, go with that.
And then I think also take some of your CBD products and mix it with the CBD product.
That's not a bad idea at all.
Which will help quite a bit, because the CBD product will counteract the THC effect and really can help you quite a bit. I know RSO is very effective, but you got to be very careful with it. And I would probably, rather than starting with the RSO, I'd probably start with a 1-to-1, or probably, again, what I like about Move is you sell CBD 1-to-1 and THC products. You can kind of mix and match. You don't have to, a lot of companies will sell 8-to-1s, 1-to-8s, and if they don't work, you're kind of stuck with the bottle. You have it so you can actually kind of mix your own, kind of put things together, which I think is great. You can put a little more CBD in there, a little less THC, and see how that works, which is what I love about the Move products. So it says, let's see, is it safe to take Indica product along with Trazadone? You want to try that one? You're a pharma guy.
I'm not touching that one. I'm not touching that one at all. I would say consult your physician. You can't say anything to that.
Typically, cannabis products really don't have a lot of interaction with medical products, except products that have to do with the blood. If you have anything that's like blood thinners or something like that, really, I would suggest, in fact, I highly recommend that you have your doctor and also your medical marijuana doctor, as well as your medical doctor, really talk to you. You can take them. It's just a matter of getting the dosing correct. So the answer is, if it's outside of that, there hasn't been we haven't seen in evidence, both from the CDC and also from a lot of things that are out there, a lot of negative effects of cannabis. But again, at any point in time, anytime you're doing it, consult your doctor, consult your medical marijuana doctor, and also listen to your body. Don't jump in and taking a whole bunch of it. Take a little bit, go low and go slow. And that's a way to basically be able to handle that's out there. The reason that I think Jeff is worried about addressing it is because every person's body is different. Like I said, I have one friend that if he takes one drink, he's done for the night. I have other friends of mine that drink the whole bottle. You have to really be careful about what your dosing level is. So really pay attention to not only what you're taking, but also the dosing, and just go low and go slow.
I wouldn't be worried about taking the Indica product alone, but in combination, in conjunction with Trazadone, no, I'd say consult your physician.
Jeff, one question from Jessica is, can cannabis affect HBP?
It can. It actually it can raise your heart rate, but it's your overall your resting your blood pressure. Again, that's there
are cases where when you take cannabis, it does affect your blood pressure. And there's also a terpene called eucalyptol, which if you have eucalyptol in the cannabis, you have something like that, it actually helps you lower your blood pressure. So again, this goes back to what's good for you and how it affects your body. I know I look for products that do have eucalyptol in it, because I worry about, at my age, I worry about high blood pressure, and it does help me quite a bit. But it's something to pay attention to. Anytime you take any medication to put anything in your body, you have to worry about blood pressure. But I would say cannabis does raise it. but also it also can lower it. So again, this is where you talk to your doctor and you talk to your medical marijuana doctor as well as your cannabis doctor. And also your bud tender can point you in directions of products, again, that have eucalyptol and other terpenes that might be able to help you in that particular direction. So T. Peterson says, hey guys, I'm suffering from anxiety, depression. I find marijuana to be the only thing that truly helps me improve my mood. How would I go about getting my medical marijuana card in Florida? I think we can help you do that. I work with a group called MMTC of Florida, Medical Marijuana Treatment Clinics of Florida. I work with a lot of other doctors. I'm not just exclusive with them. Because I really supply, I do Florida wide, I actually do across the United States. One of the reasons why I recommend MMTC is very simple. First of all, they have 25 clinics here in Florida, so they have a pretty good chance it's fairly close to you. But more importantly, they're the only clinics that have a dosing center. They're the only clinic that if you get your medical marijuana card from them, you have an 800 number that you can call, actually an 850 number you can call, and they'll actually help you walk through your dosing. They'll actually do counseling with you. And because of the doctor's recommendations, they can help you quite a bit. And I think dosing is really the key to making cannabis work. So there's a lot of good, I know you can go to Move's website and they'll recommend doctors and they recommend doing that. Take a look at it. But the ones I choose is one that'll help you with your dosing. So it's kind of a 2-to-1. It's not just the price of the card itself. You're getting some helping with your dosing, which is really, really critical to making it a positive experience.
I know those guys well. I've known Dr. Dorn, Joseph Dorn, for a number of years now, and his partner Sonny are great guys, great friends. So definitely a quality run organization with MMTC.
So Emily asked the patch. She says, "My patch is great, and I got dizzy when I took it off after the day 4. Should I still use a vape to come down?"
It's a good question. So you got dizzy after you took the patch off?
Yeah, it's interesting. That's what Emily says.
Interesting. I've not heard that. And would you still use the vape to come down off of it? That's a first. I would probably consult your cannabis physician on that one, Emily. That's I don't know. There may be an underlying condition that there may be something I don't know about your health and your, what's going on. So I would say again, talk to your doctor, let them know what's happening, your cannabis physician, as well as your primary care, if you have one, and ask them what their thoughts are on that.
Yeah. Anne asked, can you use can you use a tincture with the patch? And I think we answered that. The answer is yes. So one of the questions is, does it work for neuropathy?
We're seeing a lot of patients that, are using the topicals for neuropathic pain. Actually, we're seeing a lot of fantastic results. And if you're experiencing neuropathy in your legs or your feet or your arms, we're seeing rubbing it on the back of the neck at the base of the hairline. Is actually showing some pretty statistically significant results. So, I can't say it works for everyone, but I would definitely, I would give the topicals a try and see how it works for you. I think you'll be pleasantly surprised.
We did a webinar on fibromyalgia, and we also touched on neuropathy, and the answer is yes, it works very well. So it's something to really take a look at. One of the other issues, is it good for anxiety? Jeff, what do you think?
100%. Well, yeah, 100% for me. That's probably one of their number one, our patients are coming in, hey, I'm in pain, I'm in anxiety. And that's, it's like, oh my God, my life has been changed. So yeah, 100%. It definitely helps me and a lot of other people. So I hope it helps you too, Richard.
Prior to COVID hitting, when we were doing live seminars, we'd do it throughout Florida, and we had to stop because of COVID. And that's where we moved to this particular webinar series. But it was amazing that subject came up every time, and we had a good discussion of it. And there were a lot of people that did use cannabis for anxiety, and the feedback I got was just amazing. We got a tremendous amount of positive feedback for anxiety. And you can see by the studies we referenced in this particular presentation, there's a lot of proof that it does work for that. So Chris asked a good question. Sleep is a big issue for me. Is a hybrid good for such a case? Jeff?
Oh yeah, I think we touched on that too. Yeah, we're seeing some fantastic results, and one of our strains that we offer it, Black Mamba and Blueberry, two hybrids that you could see the from the strain print results. You could see some I think it was like 68-72% efficacious in helping with insomnia. So to answer your question, yeah, I think that a hybrid, if that's where you want to go, give it a try.
Now, Jessica asked the question that's near and dear to my heart. What is used for bulging discs? Do you mind if I take that one?
Go ahead. Yep.
Having herniated discs in my neck, and also I have two in my back. I found that my regimen, and again, it's all different for every person, but I found my regimen of using a tincture oil, especially when it's high in CBD, coupled with a vape pen, helps quite a bit. Now, I found that over time, literally after about 2 to 3 months of using the tincture oil, I found that the pain level and the inflammation from the bulging disc went down. In fact, my auto accident that I was in was almost 4.5 years ago, and I went to a medical doctor approximately about 2 months ago, and he was commenting about how the bulging of my discs has actually been going down, which is really interesting.
Wow,
that has
is
to do with not only just using cannabis, also it's crazy. I'm doing an exercise routine. I'm into Tai Chi right now, and that's helped with quite a bit as well. So the physical exercise coupled with the cannabis, and also losing a lot of weight, getting myself in better shape, has helped all the way around. So I wouldn't say there's a silver bullet. It's not like you take one pill and all of a sudden it goes away. But I'd say pay attention to a high CBD based tincture oil with a vape pen, and then also talk to your physician or getting the appropriate exercises to help you be able to put that all in place. That's out there. I know that like I say, my wife says I shouldn't talk too much about it, but the Tai Chi has done wonders for my body, being able to help me get over the accident that was out there.
You were mentioning that yesterday. I'm going to have to look into it. I was pretty impressed by some of the stories you were telling about your sensei or.
Yeah, actually we call them sifus in it's a kung fu world. I belong to.
What is it called?
Sifu.
Sifu. Okay. All right. I didn't know that.
Senseis, we have sifus, and it does work. I have to tell you, you get the right Tai Chi folks, and it's tremendous for your health. I know a lot of martial arts are more for defense and fighting and that type of thing, but this is more for your health. Probably the best for health, and I recommend that you take a look. It's out there. Last question, and we'll wrap up with this one that's near and dear to my heart. Are you going to open up Move in Claremont? And I live in Claremont. So.
I do believe we have plans on being in Claremont. I can't say to exactly when. Again, it's there's a lot that goes into opening up a new location. A lot about it is is it allowed? I do believe that is one. I can't say 100% sure, and I've got a list of new moves that are in the process of opening, and I don't have access to it right now, but there's quite a few across the state. I believe Claremont is one, but I can't swear to it. So
I've been told that you're eyeing Claremont, and I think there's also a lot of politics of being able to get the approvals here. That's really
yeah, and unfortunately that's happening. Each county, each little municipality is different. So
and the last question I saw in the chat was by Jessica, and she was asking, does your body weight have a lot to do with your dosing? Really not. Every person's body is different. We had a patient that was very, very big, actually a football player that was from Florida. And the guy could take no THC at all. I mean, it was just amazing. And it was amazing how much. And yet we've had people that are kind of short and scrappy that had high tolerances of THC. So I think it just has to do with the metabolism of your body and not necessarily your body weight.
Right. It all goes back to kind of, that's not, one size fits all. And it's kind of like a little, opposite of alcohol, where you think, alcohol, what you find is larger people tend to take a little more alcohol. It's like you mentioned, it's not the case with cannabis. Completely different. So
well, listen, Jeff, I want to thank you very much. We've been at this for almost 2 hours, and I want to thank everybody who are still with us, because hopefully we answered your questions. Hopefully we got you information that will get you the information you need to basically get your life back. And as I mentioned, what you're going to get is an email follow-up that has a copy of a link to the YouTube video, the presentation, a lot of the research that we've done, a lot of discounts that are there. But Jeff, do you have any wrapping up questions?
I just want to thank you guys. Thank you, you, Mark and Lee, for what you guys are doing and helping educate patients, across the state. I think I saw some folks joining in from New York State. So, I mean, fantastic stuff, what you guys are doing, and really appreciate everything. So keep up the good work, and we'll do our best to keep coming out with the good products, and hopefully we'll have those topicals out very soon. I apologize for those of you guys that are looking for them. We've got a lot of folks that are, and just unfortunately with the circumstances with the global supply chain, we're just unable to produce them, but they're coming. I just can't tell you when. So thanks for everything, guys.
Jeff, I want to thank you. And more importantly, I want to thank everybody who's been on this webinar. We really do appreciate you following up. And again, I hope it really has helped you quite a bit. Our objective is to really bring quality, qualified information to you. And we're going to continue to do that. Next week, our webinar is on seniors. We're talking about how seniors and medical marijuana work together. The week after that, we're talking about arthritis. So I think there's a number of different, webinars coming up. The week after that is dosing. So we've got a good schedule coming up. Please join us. And again, thank you, everybody. Jeff, thank you and Moo for what you've done. Thank you, everybody who's been online. And Lee and Deja, I know we don't talk much about Deja, but both of you have done a great job.
Yes, thank you, Deja.
And put things together. Thank you to the moderators. And last, I'll give a last shout out to Alyssa. She's the lady who came up with the concept and got this thing started. And without her, this wouldn't have been happening. So thank everybody. And listen, everybody have a great weekend. And look forward to seeing you next week for seniors.
Thanks for joining, guys.